Medical Dilemma.
Welcome back to Medical Dilemma. Before we proceed to the main discussions for our topic today, I'd like to thank our major sponsor, St. Clair's Medical Center, located at 1838 Dian Street, Palanan, Makati. Now, joining me and Dr. Calimag in this segment are our co-hosts. We have Attorney Sarah Sugitan of the Sugitan Law Office.
Hi, Sunny and Dr. Minerva.
Okay. And then we have Father Jerry Manlangit, a bioethicist from
Hi,
the Order
Sunny.
of Preachers.
Thank you for having me here.
Welcome, Father. And Dr. Teresita Sanchez, a medico-legal practitioner and our advisor for the show.
Welcome to everybody here.
Okay, now let's go back to the patient-physician relationship. Now, I have observed that some patients become more trusting of their doctors when they know a little bit of the personal life of the doctor. Okay, do you agree with that observation?
I don't think so.
You don't think so?
I don't think so. Although as friends, maybe you're a family friend, definitely you know something, and probably you will ask the questions more from them than anybody else. Well, but it doesn't follow.
Well, the major question is how much of a doctor's personal life, values, and belief system should he or she bring into the physician-patient relationship?
Nothing about that much of the personal life of the doctor. Well, it doesn't count much. No?
It doesn't count much.
What is important is the expertise of the doctor, specialization, and what he can do to the patient, and how well he will be able to go through the medical process, so that when the patient comes out of the hospital, he's alive.
Okay, but I still believe that a physician's personal value system would have an influence on how he or she would recommend treatments for a particular patient.
Well, that's part of the professional virtues of the physician, not because of his personal life or personal, I would say, his privacy, but his virtues are very important.
As a matter of fact, Sunny,
Yes.
sometimes it's the reputation of the doctor that's important, and that affects really whether the decision of the patient, whether he would want to consult with that doctor or not. And reputation, you know very well, is different from the character, right? So,
Doctora, could you cite some cases where the value system of a doctor would play a large part in how a patient would accept treatment?
Okay, I think all physicians should follow the dictum of primum non nocere, or first do no harm. I think in everything that we do as physicians, we should be able to look at patient safety as an end goal and as an outcome. And that is important because once the patient knows that your expertise leads to his safety, no? At the end of the day, you will earn the patient's trust. The patient's trust.
Every year, Sunny is from
Yes.
UST,
Yes.
and he's a professor, and she teaches also ethics,
Yes, you
especially in
mentioned that
research.
earlier in the segment.
Yes,
Right.
and she's also an anesthesiologist.
That's right.
So a lot of informed consent here.
I see. Attorney Sarah.
Yeah, I'd like to ask our doctors here, Sunny,
Go ahead,
kasi
go ahead.
about informed consent. Say in the law, for example, you're selling a piece of land, a parcel of land, you need the consent of the spouse always. Dapat laging joint in case that you're married or even if you're not. But for example, your spouse is undergoing a medical procedure and you require informed consent of the patient. Pero the patient, who is of course the spouse of another person, is unable to give that consent. Is it mandatory to require the spouse's consent on behalf of the patient? Is there such a
You
thing?
mean to say the woman is living with another person, or
Meaning
what?
their
Or
husband and
separated?
wife. For example, let's assume they're married, their husband and
living
wife.
together.
Okay.
Yes, and the wife is unconscious, and there is a certain procedure that needs to be performed on the wife that she cannot consent to, she being unconscious or in a certain state. So You require the husband or the spouse to give the consent.
In the order, I think, is the spouse first, and then if the spouse is absent, then the parents of the patient.
Oh, if there are no parents, the children, for example.
The children.
Yeah.
Children of major age.
Yeah,
Children
They
of
have to
major
be
age.
of
If
major
the
age.
spouse is absent.
if the spouse is absent. Pero the spouse is the first, I think.
Yeah, the next
Actually,
of kin
the
is the
principal is
spouse.
the next of kin who can give the decision making, who is of major age.
Yes, that's correct.
So that's
The next of
informed
kin,
consent.
and when you talk about the next of kin, the most logical is the husband
Or the wife. No?
or the parents or
They come after
major
the
age,
adult
or
children.
as they say, exhaust first the vertical relationship. And then
Before
you
you
go
go,
to the
horizontal.
brothers and
horizontal.
sisters, yeah,
Right.
later on. Yeah, that's correct.
See.
Right.
You know, very important to release the spouse consent. You know, sometimes because the patient is already an adult person, independent, who wants tubal ligation or who wants, oh sorry father, tubal ligation in some hospitals, they do practice that, no? Or they want, there's a major surgery, elective, and gusto niya, no? But what something happens to her during the operation, who will, sabi nga ng isang judge, who will be left to sue you? The next of kin. So you might as well get her consent or his consent too.
Pero when you get the consent, it has to be in writing? Or is there a contract? Kasi I have never experienced this, but when something is to be done, do you require written consent?
In
or
the
is verbal
hospital,
enough?
in the
Yeah.
hospital they do.
Okay.
But in the Philippines, we allow verbal consent. In other words, for
Verbal
example, tumawag sa office mo, sa
Spouse.
clinic mo, tumawag, oh, sige, punta ka na dito, you prepare yourselves and we'll do lipectomy tomorrow, or like that, no? There's a verbal already sa telephone, and that's good. That's a verbal
That's
consent.
enough.
It would be enough, but you know, for protection of everybody, the hospital is requiring that you have to have a written consent likewise.
What if there is a disagreement between the spouses? You know, like for example, as you mentioned, if the wife wants to undergo tubal ligation,
Yeah.
we get the consent of the husband. What if the husband refuses, but still the spouse or the wife insists on going through the procedure?
Well, it's
Who will
really
prevail?
Yes, no, because you know, of course, the doctor, bahalang doktor, discretion niya yan. But an adult woman, you agree with me, right? Can decide for her own, on his own, whether
As an
she wants it.
individual.
Yes, as an
I think
individual.
the individual will prevail.
However, for the sake, sabi nga nila, of marital harmony,
That's
sometimes.
I think the issue that's involved here.
Yes,
So,
because
Precisely, no? If there is disagreement, well, in this case, the husband should prevail.
the
Why?
husband should prevail.
Because for a procedure to be legitimate, both must agree. If one doesn't agree, the procedure should not go on. Why? Because, you know, in marriage, you are supposed to be one. Well, the ethics would come in. You are supposed to be one body.
if it
and
is something, Father, elective, right, and
Yeah,
not life-saving,
actually-
really.
Not actually, for life-saving, well, it should always be the next of kin. If there are no other people who will give the decision, the doctor can do so, because it is emergency.
Oh,
Okay?
if there's
Doctor
no
can
one
do so
around. Oh.
in loco parentis, and he decides in favor of the well-being or of the patient. It's always like that. It always goes to the patient as the center of decision making. What would have happened if the patient is competent, for example? What will be his decision? That should be in the foremost in the mind of the doctor. What will be the decision of the patient? And certainly the decision will be for his benefit, not
Okay.
for the benefit of anyone else. Because the first one who should give the decision here is the patient himself.
Is there a foundation for this in the law, Attorney Sagitan?
Yes, when it comes to decision making, of
Yes.
course, as we already mentioned, tackled in the previous episodes, it's your body. Therefore, the decisions that you make for it, you'll be accountable for that. So the law is actually silent about these things. So when it comes to, for example, a conflict, let's make it even more concrete, Doctora. Ectopic pregnancy. Tapos the spouses are in disagreement as to who should survive. Diba? So that's when ethics comes in. A lot of values comes in. Who do we save? If the wife wants to save the baby, for example, but the husband disagrees, wants to save his wife, then as you said, it depends on the doctor. I think what will prevail is the life saving. But whose life, for example?
Well, I don't know. If you're adult and you're conscious, and so you're aware of what's going to be done to your body, the final decision is yours. For example, there's a CS. You have to do. You're extremely hypertensive, and there's danger to your life, no? But you're pregnant. No, the husband cannot say no. They should go to term, and everything. It's really your decision. But as I said, the court said, no, maiiwan yung next of kin kaya papirmahan na rin. How about you, Irby? You're in anesthesiology, so what is your experience in these ways?
Most of the time, you talk to them. You talk to them together. So you give them, they will know each other's views. So and then you can guide them as to how they decide on a certain line of decision.
What if they
Because
disagree with you, with the
Yes,
doctor?
that's the next question. What if the patient disagrees?
Then
With
maybe
the
you
both
can
of
get a
them.
second opinion.
You
Second
will ask them
opinion.
to get
Yeah.
one.
But in the case of tubal, what do you call it?
Ligation.
No.
Ectopic.
Ectopic
Ectopic.
pregnancy is
Oh.
an emergency and it's always life-saving.
Ectop-
And the
yeah.
baby is not expected to survive
Right.
anyway,
Right.
even if you...
You wait.
Even if the wife prefers to save the baby, for example.
Yeah,
In
if
that
it
case,
cannot
then
be
in
it will-
ectopic pregnancy, the baby...
It won't reach
It
term.
won't reach
really.
term.
Mm.
Pero when it comes to informed consent, is that tantamount to a waiver? For example, like if the patient and his or her spouse gives consent, and then later on something gets batched up, I mean, does that also include a waiver on the part of the patient, na he or she will not go after the hospital or the doctor?
No.
Not necessarily.
No. It's because the law says you cannot really waive or
A future.
be excused from future negligence. If there's really negligence, then there should be a basis.
But I'd like to push that point further. So if you give informed consent, does that cover everything?
No, usually it's a particular
Or just
procedure.
that particular
Not really.
procedure?
Particular procedure.
It is not even a waiver.
Not even a waiver.
It is not a waiver.
Yeah, that's very clear.
That's very
Right.
clear. It is not even a waiver. You are consenting to a procedure
Mhm.
that it should be done. That you are consented
Yes.
it. Go ahead. But with a very minimalist danger to the life of the patient. Well, when you talk about informed consent, simply, it is a consent given, but it is characterized by information.
Correct.
That is information.
Okay.
So,
Well,
yeah.
we're sorry, Father Jerry. We'll have to hold that point for a while and give some time to our sponsors' words. Okay, just stay on this channel. We'll be right back.
Many of our products were designed to be used in industrial and medical economy.